And we're recording. So if you can, please tell me your name and where are you from?
My name is Stephanie Robinson, and I'm from Eugene, Oregon.
And when were you diagnosed with endometriosis?
I was diagnosed with endometriosis in 1998.
And so far, how many surgeries have you had to endure for endometriosis?
4.
So far, you've had 4.
Right, going to be on my 5th pretty soon.
My goodness, okay. So, going way back to 1998, what was the scariest and what was the hardest part about having a new diagnosis of endometriosis?
I guess going back, the scariest part for me was I didn't know what was wrong with me. I kept going to the doctors and they kept saying that I could have appendicitis. And I didn't have appendicitis. And I finally found a doctor that did a laparoscopy, and he told me I had endometriosis, but I didn't even know what that was. I had no clue. It scared me. I'm like, is this cancer? What is this? I had no idea. Like, nobody's ever talked about endometriosis. I just didn't know what it was. It was horrifying.
So right after you were diagnosed and you had to figure out what endometriosis was, especially since you'd never heard of it before, what was that like, learning about this new disease that you weren't going to be able to get rid of?
It was scary. I talked to my mom and I found out that she had endometriosis and I had no clue. She never told me that. She ended up having a hysterectomy and thought that her endometriosis was cured, but it wasn't cured. She still has endometriosis. It was more of an anxiety factor. I got on the computer and researched as much as I could and did everything I could. I tried to find support groups back then, but there really wasn't anything. Facebook wasn't back then, so it wasn't, as easy to get in touch with other women that have it as it is now.
That's important to note. I think that was awesome. So, when you talk to people who have no idea what endometriosis is, what do you find is the most common misconception?
My favorite one is people think that you only have pain during your period. And to me, that's the biggest misconception of them all, because I can have pain all month long. It's not just during my periods. Yes, it can be worse during periods, but it definitely does not stick to just periods.
And if you could pick one thing that people knew about endometriosis, kind of a baseline information starting from here, what would be the one thing that you wish everyone knew about endo?
I wish people would understand just because we look fine doesn't mean we are fine. We look great on the outside. We all look normal. We don't look sick. But that doesn't mean we're not in pain, and it doesn't mean that we're faking it. It's very real, and it's a very misleading disease because you can't see it on the outside. It's in the inside, and I feel like it's misleading. I think people think that just because we look fine that we're supposed to be fine, and we're not.
Very true. Very true. So, when you look at the negative impact that endo has had on your life, I know there's 1,000 different things, but how has endometriosis had a negative effect on your life in the most profound way?
I think holding down a job. For me, I could never hold down a job. I was always getting, not sick, but I'd be in pain to where I couldn't work. And employers don't understand that. They're nice the first couple times, and if you have to have surgery after surgery, they're just kind of like, okay, I don't understand. You should be fine. You just had surgery. You shouldn't have anything wrong with you now. And I think employment has been my biggest thing. It's hard to work when you're always in so much pain.
Good point. So, if we were to switch to a positive, what does it mean to have an endo sister? Someone that you don't have to explain things to or apologize to, now that you have that support network that you didn't in the beginning. What's it like to have an endo sister?
It's amazing. I think it's like having millions of best friends, and some of them you get to become super best friends with. They understand. You don't have to explain yourself because they just know. And I think helping each other just through the support groups and saying, you know, I'm having a bad day, you know, and they're like, I understand. And, they, you know, they make you feel good. They don't make you feel bad for having a bad day. And they don't try to make you feel like you're kind of worthless because of this disease. They just keep boosting you up. And I couldn't imagine not having them. They're so important.
And who has been the most supportive in your life? Almost a shout out to whoever's really just been in your corner, no questions asked, as you have to endure this battle.
My sons, Jordan and Jacob, for sure.
And how have they supported you? I mean, what have they done along this journey of yours that just really keeps you going?
They're just always there. When I don't feel good, they're there to make me smile, and they're there to they always support me, and they always make me feel good, and they think it's great that I do groups on Facebook, and they think all these women are pretty neat, and they try to get involved as much as they can, and they think that we're all pretty cool ladies, and I agree.
Awesome. So what does all of that support mean to you? Whether it's from your two boys, whether it's endo sisters, the few and far between employers you can get to support you. What does that support mean for you, and how does that support help you as you have no choice but to endure endometriosis?
I think that with the endometriosis, it makes me just push forward. It makes me realize I can't give up. Giving up's not an option. I have to be strong for my endo sisters. I have to be strong for my sons, and I have to keep pushing, you know, no matter what any, you know, medical problem I have, especially the endometriosis. I have to push through, and I have to be strong and powerful, and you know what? Just because I have this doesn't mean that I won't conquer it someday, you know, because that's my goal.
And as far as medical professionals go, if you had 5 minutes with a group of medical professionals, the ER doctors who are going to encounter endo patients, the GI specialist, urologist specialist, they think they may never see an endo patient, but will be there. So what would you like to say to anyone and everyone from all different walks of life in the medical professional arena about endometriosis? What do they need to know?
I feel like they need to know that our pain is real. Our pain is not in our heads. We're not women that are drug seeking. We're not addicts. We are in real pain. This is a real disease. And like I said before, just because you can't see it doesn't mean it's not real. And I think the hardest thing is when the endometriosis patient has to go to the ER and they look at you and say, take ibuprofen. It's no big deal. It is a very big deal because, you know what, it's painful. It's probably the worst pain you could possibly imagine, and it's real. And I just want doctors to know that it's real, and we're not telling you that we're in pain just because. We're telling you we're in pain because we're in pain. You know, listen. I guess listen to us. That's the most important, is listen. We need you to hear us, not silence us. Hear us.
Awesome. So, you know, I personally have never broken my arm, so I don't know what it's like to try and itch my elbow with a pencil, you know, and be frustrated by that. So there is a difference between empathy and sympathy.
Right.
But if you had to try and explain the pain of endometriosis to a man, a woman, a young girl, a young boy, what would you try and compare that pain to? I mean, what would you say to really attempt to get them to understand what the chronic pain of endometriosis feels like?
Well, I would say it could be like the worst childbirth ever, but other people wouldn't understand that aren't women. It kind of feels like, for me personally, I know for each woman it's different with their endo pains, but for me it's almost like your insides are being ripped apart, you know, you're being torn apart from the inside, and there's nothing you can do to fix that. You know, there's nothing to stop it, and it's just, you don't know when it's going to come. It's kind of like, you know, like an ocean. It just kind of, it could be very calm and quiet, and then all of a sudden it hits you really hard, you know, like a big storm, and it's just like, it's just brutal. I mean, I guess it's really hard to describe, because it could be, everybody's pain threshold is different, and everybody's pain is different. But for me, it just, It's awful. It's almost worse than childbirth. And I had natural childbirth, back labor, so that was bad. And it can be worse than that. So, I mean, it's bad. And it's real, and it's horrible.
The storm was perfect. I think that is a great metaphor. They can just hit like that. One day you could be okay, the next day, hurricane whoever. So
Right.
Hurricane Aunt Flo. So okay, so the last couple of questions, which is why we're here. When did you first hear about the Million Women March for Endometriosis?
I first heard of the Million Women March for Endometriosis on Facebook, actually, and I saw it, and I just wanted to be involved right away. I just want to spread awareness as much as I can, and then I Googled it, and I found it on the internet, and got all my info.
Perfect. And are you going to attend the Million Women March for Endometriosis in Washington, D.C.?
Yes, I am.
So go ahead and say the whole thing for me.
Oh, sorry. Yes, I'm going to attend the Million Women March in Washington, D.C.
Perfect. And, okay, so your video skipped out, so guess what? I'm going to seem like the worst Barbara Walters ever, and I combed my hair with the leg of a chair. But are you going to be attending the Million Women March for Endometriosis in Washington, D.C.?
Yes, I will be attending the Million Women March in Washington, D.C. for endometriosis.
And if you could complete this sentence for me, I'm endo-marching because.
I'm endo-marching because awareness needs to be brought for all of the endo sisters that are, in so much pain, and for generations to come. I don't think that younger girls should have to suffer like we are. I think they more, we need to be heard, and this needs to be not a small problem. It's a big problem. It's 1 in 6 women. Something needs to be done.
And what will it mean to you to be able to be a part of such a historic event and the first annual Million Women March for Endometriosis? How will that feel to be a part of that grassroots effort?
I think it's going to be amazing. I've worked so hard on my own on Facebook, and to be a part of the Million Women March, I think would be just amazing. It's an epic event. If it continues and it's annual, then it'll be amazing. But to be a part of the first one and to help out, it's amazing. We're setting groundwork for other generations.
And on a final shout out, if you could say something directly to the Dr. Najats ×3, the sponsors and affiliates that have gotten on board, the women's health forums, the soon-to-be endo specialists out there, what would you like to say to everyone who has gotten this effort off the ground and really gotten the ball rolling for this first awareness campaign? What would you like to say to them?
I want to say thank you. Thank you for listening to us. Thank you for wanting to help us. It means the world to me from the bottom of my heart. There's so many women, and it means so much to us. And all I can say is thank you. And please continue, and don't give up after this event. Please keep going, and let's not stop with this. Let's keep going further and further.
Awesome. Okay, so give me a big smile. They flash frame it.